most famous physical therapist on the internet.
Hi, folks. I'm Bob Schroep, physical therapist.
Brad Heineck, physical therapist.
Together, we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Today, we're going to show you how to get rid of painful, stiff neck with just one exercise. Guaranteed, right,
Bob?
Brad?
We got a good, some good information on this. I think it's going to help a lot of people.
Just worked with 3 of your patients, right?
Exactly.
I'm not trying to steal your thunder, but if you're new to our channel, please take a second to subscribe to us. We provide videos on stay healthy, fit, pain-free, and we upload every day. Also, you want to go to bobandbrad.com because we're always giving something away. Today, we're not. It starts tomorrow. But if you go on the Bob and Brad, you'll see it listed for tomorrow. Well, not probably not. Go on Sunday. It'll be on there on Sunday for sure.
We start on Sundays with the
it finishes on Friday and starts on Sunday.
Yeah.
Go to Bob and Brad on Facebook. It'll also be pinned to the top of the page. If you want a shorter version of us, go to Instagram or Twitter. We got a 60-second version of our show.
There you go.
I got through it, Brad.
Yeah, excellent job, Bob.
All right, thanks.
Shall we continue?
Yes, let's
All
start.
right. So neck pain is oftentimes associated with a stiff neck. And not only that, particularly I had 3 patients had very similar symptoms. And we've heard these complaints over the years many times. It's very common. Neck pain oftentimes refers down into the scapular area, sometimes down into
shoulder
the arm.
blade.
Yep, shoulder blade here. And that's what all 3 of these were. Neck pain down into the scapular or the shoulder blade area, oftentimes one side, not the other. It could be both sides. And all 3 of these people were limited with range of motion, right and left rotation. One side's typically worse than the other. And then say, can you look up to the ceiling like this? And all of them were like, that hurts. Which is very typical.
Right. And a lot of times they feel, well, because it hurts, I shouldn't do it.
Right. And I had one patient. He's been taking his ibuprofen. He's been doing some stretching. He had a TENS unit from another injury. He tried that. He says nothing's working. So I said, well, let's give this a
go.
Okay. So now all 3 of these people, I used this is the same exercise, but various options, 3 variations.
Sure.
So just kind of hold with me. And if you try one of these 3, there's a good chance that you're going to increase your range of motion and decrease your pain.
Yeah, actually, Brad, I saw a study that was done in lacrosse.
Oh.
That if you increase your extension, you also increase your rotations.
Yep.
So, by the way, should we mention that if you should never do this if it makes you dizzy or lightheaded?
Right.
You know, you're going to hold off then, and you're going to want to have a professional.
Right. You're going to go in and seek some help.
Yeah.
Good point, Bob. The next thing is you need to have a chair with a backrest that is low enough. Now this one is just about I wouldn't want it any higher than this.
It's nice if it can go below the shoulder blades, actually, just right below the shoulder blades. This one kind of hits you right on the tip, doesn't it?
But it works because it rotates.
It rotates,
and it'll work. It's right on the borderline.
You can do it on a stiff back, but it should be lower then.
Yep. One of these office chairs really work well. They're a little cushiony.
Yep, they're a little cushiony. Yep, they kind of work.
It's important. That's why we want to emphasize that. And then the repetition, so we remember it is usually 5, no more than 10 repetitions at a time. And as long as the pain gets better and the motion improves, you can do it as much as 1 time per hour and get rid of this.
And I think that's a good point, Brad, because a lot of people think that I'm going to do my exercise once a day like I'm supposed to. It's like, no, you really want to do this quite often.
Right.
I mean, 5 to 7 times, 5 to 8 times a day. And that's where you're going to see, some gains made. Then.
Right. There's one more thing. I know you're interested. You really want to start seeing the exercise, but all these are absolutely critical to be successful.
Sure.
Is monitor your posture while you're sitting, particularly at a computer, watching TV in your car, because if you do these exercises and you go back to head forward slouch posture, it's just going to
come right back.
1 step forward, 2 steps back.
Yeah, you can't stay ahead. You won't be able to stay ahead of it.
Right.
So
okay, now I need to take my mic off, so then you don't have to listen to me talk anymore. Bob gets to do all the talking.
If you say something, Brad, I'll just repeat it.
Okay.
I mean, if there's something I miss.
Right.
So.
That'll be entertaining in itself.
It's like a puppet.
Yep. So because what happens is we're going to use a towel roll first. It binds up with the wires and everything else. So I'll just talk and I'll be like a mime. All right, I got that out of the way.
What a wonderful world.
All right.
Okay, so he's going to take the towel. He's gonna roll it up. He's got a quite heavy, thick towel here, and it's just like the old days where he used to snap his buddies' butts. Yeah.
Okay.
So he's actually in this case because there's a couple ways you can do this, but he's actually pulling down, and you can work a little bit on the level that you're putting it, but generally we just start right at the base of the neck. And what you'll find is a lot of times without the towel you can't do it. It just hurts too much, and most patients I have to use the towel to start, and they always seem to really enjoy the fact that all of a sudden they can start moving back. And you may not be able to go that far to start, but you'll be able to go farther than without the towel. But yeah, just take the movement that it allows. So, maybe for a couple days you're only going to go about 50% of how far, the total amount. But eventually, you want to see if you can get further and further. Yeah. So what Brad is saying is a lot of times instead of just going back, we start getting your posture correct by tucking the chin in and then going back. Because what we don't want is somebody going like this. So that's why we chin tuck and go back. So
So now, if we're not having good success with this,
so we're not having good success with this.
wait a minute, if we're not having good success with this, then the next step. I'm sorry, Bob. I can't just let you
Right,
do
right.
talking. We're going to go to. You can use a belt. Usually not a
Are
slippery
you hearing
belt.
a little closer, Brad?
Little oh, how about that? Hello.
Yeah.
And then
He's
what
going to
we're
use
gonna,
a belt.
yeah, a strap that has cloth versus
Closer.
a shiny one.
Okay.
Oh, these are sensitive.
Yeah.
Oh, Bob, I'll let you go.
All right. So he's got, I mean, you could use a belt too. I mean, I've done it with a belt actually. What Brad was saying is it's nicer if they're very thin because then you can really get onto specific levels of the neck. And you can, because sometimes you'll find out that it works out really well quite low. Sometimes it's better doing it further up. And so you can vary and figure out which level actually works for you. How do you know it's the right level? It actually feels better. I mean, and the more range, right? It's going to allow you to move further. So right now, Brad moved it up a little further, and there you go. And he's about an inch at a time, and he's starting to pull down. Yep, and now he's starting to get more motion.
All three of the people I worked with, there was a certain level that clearly.
All right. So yeah, Brad's mentioned that all three of the people he worked with, there was definitely a specific level that worked better, and one was up higher. Yes, and I found that myself sometimes. But yeah, a lot of times normally the stress is on the lower neck, but I've seen it myself too, where sometimes are you getting feedback? You're hitting the mic, Brad. So. Okay, and now he's actually going to go the other direction, and this is a different variation. the The joints actually are angled like this, so he's going to kind of go along with the joint itself, and then he's going to actually, when he's going back like this, you see his hands are moving along with him. He's not just doing this. He's not doing this and now go back. Yeah, he's going with it. The eyes are staying level with the fists or the thumbs. So this is another variation on how you can do it. That's a good cue. So he said if you put the thumbs out, they point right into your eyes, and they should stay with the eyes. And again, you can try different levels using the thinner strap. But this one, I'd start with the thicker one. Got the mic here. You start with the thicker one.
I'm going back.
Yeah, he's going back on. And then usually if you can try a thinner one, it's going to often help.
Can you hear me, Liz? Everything's okay. Well, that was really hard, Bob.
Yeah, it was. It's like I've had patients that can't speak our language. I've used interpreters.
Yeah.
And I think, oh, it's just terrible.
Yeah, it's challenging.
So you're going to show one more with the traction, right?
Nope, we just did that one.
Oh, I see. I see what you're saying. Okay.
That
yeah,
that
that
because you're pulling.
you're pulling up. It actually almost gives a little traction to the
Right,
head. Is
right.
what we were
Yep.
the point we're trying to make.
Exactly.
So
Yeah.
yeah, give these a try. Experiment around with them. Always remember though, it should be no pain or less, certainly less pain than you would be doing it if you were doing without using the
Right.
device.
With repetition.
You're always going to be pretty safe if you keep that no pain credo
Right.
and no dizziness and so
Lightheadedness. Yeah.
right.
Those are critical red flags to watch out for.
And remember, Brad and I are not just
Oh,
pretty.
we're oh yeah, we're pretty ugly.
Yeah, no, we're pretty handy and
Yeah.
helpful. So
Yep.
make sure you
If
subscribe to us.
that's right, we can just fix about any. Oh yeah,
Yeah.
we can't double up.
You can't double up.
Oh,
No,
sorry.
don't you dare.